Like the rest of the world, Australia is facing a healthcare crisis. Our growing population and a lack of foresight in the past has caused a severe shortage of healthcare professionals. There are no longer enough nurses to staff our hospitals, and the nurses we do have are overworked and overstressed, which has led to a steady exodus from the profession. Australia's nursing organisations are putting pressure on the federal government to fund more places at universities, but money is limited and nurses are needed now. As a short-term solution to staffing shortages, qualified nurses are being recruited from overseas to work in Australian hospitals.
What prompted me to come to Australia, and they just said it's a fantastic country, English speaking, which always helps, and the weather's awesome.
I needed to improve my nursing skills. I also needed to get a chance to get to the Western world.
First impressions were very positive. It was about 35 degrees. I had just flown from London where there had been a snow blizzard, and we had actually missed a flight because of it. So the first thought was, yeah, this was a good decision.
We try to be as helpful and supportive as we can organising an overseas nurse to come out in. We organise obviously everything to do with their visas and everything like that.
We do try to offer them on-site accommodation for the first few months so that they have an opportunity to settle in, a chance to look around to see where exactly they would like to locate and live.
When they arrive, then we have an integration program that goes over 4 weeks, where they're given time to settle into the environment. They have some competencies to achieve in that time, and they are supernumerary, and they work alongside somebody for that 4 weeks.
We don't expect them to be out here running the ward and know all aspects of nursing care within our hospital and know every policy and procedure. We do support them.
There's a clinical nurse educator. She sees to it that you get everything you want whenever you don't have any, you don't know anything, or maybe you're not comfortable in doing anything, or maybe you haven't done it before. Just call her, she witnesses you doing it, and you just go on.
The nurse unit managers and the nurse managers have always made sure that I was comfortable here, and they were always open to feedback and suggestions.
When I started my first day work here, they put you like a preceptorship week, so you're with an assessor. So they taught you through everything. You get a lot of backup if you needed, and I just think the help's been great here.
Anything else?
I feel very much welcomed here and very much accepted, getting lots of help from my colleagues, and I've noticed there's a great team spirit.
When we started, it was difficult to understand the accent, It was difficult, but they kept on talking to me and they really accepted me. I think I didn't meet any problems.
I didn't have much of an ignition problem coming here, which I thought there would be. I suspected culture shock. I suspected that I would have difficulty communicating with people. People will have difficulty understanding me, and not only the language, accent, but your thinking is different because you're coming from a different culture, absolutely, but I didn't find any of them.
Just want to check your blood pressure again, okay? All right. Because your blood pressure has been all right.
You learn a lot. You learn most of the procedures which we don't do it down in Africa. And even the equipment itself, you learn the sophisticated equipment which we don't have in Zimbabwe. So it's a challenge, because obviously I know when I go back home, I'll be a star.
I'm contracted here for 2 years, but it's going to be a permanent move, I think. I don't think I'll be going back to the UK, apart from holidays.
Currently have permanent residency, so the hospital in fact helped with that and did all the paperwork yet again, so I just had to sign on the dotted line, so that was excellent.
I just wish if my family can come from Zimbabwe and join me here, then we'll be Australians.